It's a highly contagious respiratory disease, but there are ways to prevent you and your child from getting it. Hello, I'm Yolanda Vasquez, and welcome to Comcast Newsmakers. I am joined now in the studio by Dr. Linda Grossman. She is Chief of the Bureau of Clinical Services with the Baltimore County Department of Health. Dr. Grossman, it's a pleasure to have you here in our studio.
Pleasure to be here.
Let's talk a little bit about whooping cough, also known as pertussis. I was doing a little bit of research yesterday and just talked with you about how I saw there are some news reports that it's on the rise in specific areas, but we don't really hear much about the whooping cough anymore.
Well, fortunately, vaccines are very effective against whooping cough. So the areas where there has been a rise have largely been areas where families have not been so good about getting the vaccine for their children. And so that you don't have enough people who have the immunity to prevent it from spreading.
What exactly is whooping cough, and what are some of the signs and symptoms?
So whooping cough is a illness that gets caused by the pertussis organism kind of thing, and it causes a severe respiratory illness, the most striking feature of which is a cough that sounds like a whoop kind of thing. So
hence the name.
Yes. Yeah. And for an adult, it's a very annoying cough because it goes on for weeks and weeks and weeks, and it's hard to catch your breath in the middle of it. For babies, it's a very dangerous thing because when they can't breathe, then they can't breathe in between the coughs. So that's a problem, and they have difficulty feeding because of the coughs. And we know how often babies need to eat. So if they're having trouble eating because of their severe coughs, they run a risk of being very, very sick or even dying with it.
Yeah, it can be fatal. And one of the best ways to protect yourself from the whooping cough is immunization. Let's talk about that.
The immunizations are very effective, and they work very well to prevent it. Part of the recurrence of it has been that immunizations that those of us who are older got were a stronger shot, and so it protected longer, but there were some side effects. So they've switched to a less strong shot to have fewer side effects, but that means it doesn't last so long. So now teenagers are recommended to get a booster of this vaccine. Those of us who are past the teenage years haven't gotten that booster, so run the risk of being able to get whooping cough again. Us getting it would be uncomfortable, but it's especially dangerous if there are any babies in the household or any babies that you take care of, because those would be very vulnerable until they've had their first 3 baby shots.
Okay, and you were talking about putting a little barrier. I mean, making sure adults get the booster shot, or if you're in need of getting it again, to put that little health barrier around your child for family members and friends. You don't think about it when you're coming over to visit a new baby, but it's so crucially important, right?
Right. You know, and you know, if the people who are caring for your baby or regularly in contact have had the vaccine, then that'll help protect your baby until they develop their own immunity from the vaccines they're getting.
How long does the booster shot last?
Well, the current thinking is that the booster shot, so if you get the booster shot, it will protect you throughout your adulthood. Now, we'll see, because it's relatively new. It's only been around for about 8 years, so that we don't have a lot of long-term time to see is that persisting. But at least for right now, the recommendation is you just need 1 booster shot as an adult.
Okay, 30 seconds left. Pregnant women should also get shots as well. Tdap?
Yes, the shot
Tell me about that.
So the shot is called Tdap. The T is tetanus, the D is diphtheria, and the AP is acellular pertussis. So it's a combination vaccine. It's a killed virus vaccine, so it's safe to use with pregnant women. And the nice thing is, if a woman gets the shot while she's pregnant, then she'll be able to keep her baby protected from the time her baby's born.
Okay, and last 10 seconds, if you think your child has whooping cough, seek medical attention, call your doctor?
Absolutely, yeah.
Okay, sounds like a wonderful thing. Well, thanks for raising awareness about something we rarely talk about in the medical field, but is very prevalent, clearly.
And it's something we can do something about.
Absolutely. Dr. Linda Grossman, thank you so much. And that'll do it for this edition of Comcast Newsmakers. I'm Yolanda Vasquez. Thanks for watching, everybody. We'll see you again soon.